One of the biggest challenges in nutrition research isn't the complexity of nutrients or the biology of metabolism. It's something far simpler, yet profoundly disruptive: the accuracy of what people say they eat. Dietary recall, or self-reported food intake, remains the most common method for collecting data in large-scale nutrition studies. Yet it is also one of the weakest links in the chain of scientific evidence. When study participants are asked to remember and report what they ate over the past day, week, or even year, the data they provide is often riddled with omissions, distortions, and errors, many of them unconscious. This problem affects the reliability of nutrition science and, by extension, the dietary guidelines and health policies built upon it. At the heart of the issue is human memory. Most people don't track their eating with precision. Meals are often consumed on the go, snacks are forgotten, portion sizes are misestimated, and people tend to underreport foods perceived as unhealthy, like sweets, fried foods, and alcohol, while overreporting healthier items such as fruits and vegetables. Even among motivated, health-conscious individuals, recall is influenced by social desirability bias. People want to appear as if they eat better than they actually do. This kind of bias isn't just anecdotal, it's been documented repeatedly in validation studies. When researchers compare self-reported dietary intake to objective biomarkers, like urinary nitrogen for protein intake or doubly labeled water for total energy expenditure, the discrepancies are often striking. Caloric intake can be underreported by 20 to 40%, especially among individuals with overweight or obesity. These errors distort associations between diet and disease outcomes, sometimes weakening real relationships or creating misleading ones. Moreover, food frequency questionnaires, the standard in many large cohort studies, ask participants to estimate how often they consume certain foods over months or years. The data generated are useful for spotting broad trends, but are simply not precise enough to detect the nuanced effects of individual nutrients or food structures on chronic disease. The impact is serious. When foundational studies on red meat, sugar, or saturated fat are based largely on self-reported intake, the resulting conclusions are vulnerable to distortion. This contributes to the frequent reversals and public confusion around nutrition science, as findings shift with new statistical models or better adjusted analyses. It also provides ammunition for industries looking to discredit public health recommendations by pointing to methodological weaknesses. But the good news is that technology is beginning to offer better solutions. Advances in digital food tracking, image recognition, wearable devices, and real-time logging apps are improving the accuracy and ease of dietary monitoring. Smartphone cameras can now analyze food photos to estimate portion sizes and nutrient composition with increasing precision. Wearable sensors are being developed to detect chewing, swallowing, and glucose fluctuations, which could offer a more objective look at eating patterns and physiological responses. Artificial intelligence is also playing a growing role. Machine learning algorithms can cross-reference food logs with known nutrient databases and user behavior to identify patterns, flag inconsistencies, and correct common errors. These tools can also help capture the context of eating, timing, environment, emotional state, which has important implications for metabolic health, but is rarely captured in traditional dietary assessments. Importantly, these innovations don't just benefit research, they can empower individuals. Real-time tracking apps that provide personalized feedback can help people make better choices and see the immediate impact of their habits. While privacy concerns and data standardization remain obstacles, the potential to dramatically improve the quality of nutritional data is within reach. Still, no tool can completely replace human honesty and consistency. Even with tech-enhanced methods, participant engagement remains critical. That's why future dietary research must combine technological advances with better education, motivation, and participant training to ensure more accurate, useful data. In the end, we cannot build reliable nutrition science or sound public policy on faulty data. As long as dietary recall remains the standard, we risk basing recommendations on best guesses rather than biological reality. But if we embrace innovation, integrate objective measures, and move beyond the flawed memory of what we think we ate, we can finally bring nutrition research into the precision age and give both scientists and the public a clearer picture of how food truly affects health.